All right. Thanks for joining us for another LinkedIn Live and Partner Perspectives from Infinite Green. Today we're joined by Marco Sanchez from Genesys and Valerie Rodriguez from Infinite Green as well. Welcome, everyone.
Hey,
Hello.
Good morning, good afternoon, good evening, wherever you are.
Yeah, right. Wherever you're at in the country.
So today we're focused on a discussion around healthcare and healthcare experiences. And before we get started into some more specific questions, Marco, why don't you give us a quick overview of the Genesys platform and what you're trying to solve in the marketplace as it relates to Genesys and healthcare?
Yeah, great question. So, for Marco Sanchez, I'm partner account manager based out of the Chicagoland area. And so, for those that aren't familiar with Genesys, we're a leader in the contact center and customer experience space. And as it pertains specifically to healthcare, we're really, revolutionizing and helping, payers, providers, life science organizations revolutionize their patient experience. And also evolving how the care teams are enabled and empowered to deliver such experiences, right? And so there's a lot of different ways that we're covering that. We'll certainly cover that today. But outside of healthcare, we're delivering or helping, I would say, elevate experiences across many different verticals, including financial, banking, travel, leisure, retail, manufacturing, and everything in between. So if you're an organization that is centered around delivering quality and exceptional care to your customers and enabling your teams to deliver such cares through whichever mediums of different channels that they would like to, then you should think Genesys. And so we'll talk more about that today.
Great. Thanks, Marco.
Mm-hmm.
So as it relates to patient experience, what specific things have been changing and evolving from a patient experience perspective that Genesys has been witnessing in the marketplace?
Yeah, great question. So there's a lot there. And so, what you're seeing is there's still a lot of traditional, payers, providers that are, on legacy systems. And so a lot of what you're seeing in the marketplace, and it's not necessarily unique to the healthcare space, but there is still quite a bit that are still on, outdated technologies and legacy systems. What you're seeing is a lot of these organizations are, either adding more licensing to outdated legacy technology or layering in more, third-party applications. The biggest shift that we're seeing today is, I would say specifically in healthcare is around, kind of two key areas that we'll dive in more today around patient access and addressing, care team gaps gap in care. So the shift in the AI conversation has certainly, raised the spotlight in this as organizations are more, focused on not only delivering good patient satisfaction, but it also being deliberately tied to revenue collection and overall, patient satisfaction across the board. So one of the biggest shifts that we're seeing right now, is it's shifting from, the conversation from generative AI as well as to now you're hearing agentic AI. And so we'll talk a little bit more about that and how we're going from using tools that are just only collecting information, but now moving to a place where, some of these tools are actively, working on behalf of these providers, payers, to deliver better experiences and free up some time to some of the staff, doctors, nurses, et cetera, to do some of more of the complex human-only capable work, at that level.
Yeah, that's interesting because I think, as consumers get used to using AI tools and other automated tools, whether they're using banking applications, insurance applications, retail applications like Amazon and whatnot, they're getting used to having some of these automations, these automated bots, these automated questions and answers tools, if you will. And I think the healthcare industry as a whole has lagged a little bit behind some of those other industries in using some of those tools. But what's interesting is they have the most data that they could leverage to create those experiences. And so I think that's one of the barriers. Is I don't know if it's they are afraid to use those tools to get more proactive with customers and to start automating conversations. Could you talk a little bit about some of those barriers you see in healthcare specifically as it relates to automations, AI, and those kinds of experiences that customers might have in other verticals?
Yeah, absolutely. So couple themes I think across the board, not just healthcare, right? Budget obviously is still a big factor in some of these decisions, and understanding roles and responsibility. What we've seen some of the successes, especially around healthcare and some other organizations, is creating some level of circle of excellence, or a circle of health excellence, or patient experience, or something like that. Because what's happening more and more is there's more decision makers that are part of this process, right? It's no longer just a tech conversation.
Sure.
No longer just a business conversation. And ultimately it lands on the financial person's desk to ultimately decide, what are we actually trying to solve for? Are any of these things that we're looking to pursue actually useful? And, what does security and compliance look like in all of that, right? And that's going to be a big factor as well. I think what we're seeing too over the last few years, is it really comes down to a lack of understanding. And the lack of understanding creates trepidation for a lot of these organizations, right? And obviously that's really where I see the secret sauce with Infinite Green, for example, is how do we get these consensus of these people to come together, understanding common goals, objectives, but also let's shake away or shift away from some of the confusion that's going on. A great example of that is 3 years ago, any health providers that anything that was said about generative AI, they wanted nothing to do with it, and the reason nothing to do with it was because of the security concerns, and just candidly just didn't know enough about it. And what does this actually mean? And how does this, how does this pertain to patient health information and confidentiality of data and all those different things, right? And so I think education is the number one thing right now that organizations are attacking and understanding. And I think ultimately it comes down to implementing things slowly, in a drip method, right? You're not trying to boil the ocean and trying to enable every single AI feature functionality on day one. It's just not, it's not possible really, and it's not going to be an effective strategy. So start with something small. Start with, predictive routing, for example, as a Genesys capability where we could, start understanding or add this feature from a standpoint of knowing what your issue is and routing it to the proper person on the care team that's going to be able to handle that issue. That's something that we could turn on right away, for example, and you can immediately start seeing what type of ROI capabilities are going to be happening there, because it's going to start doing some routing, testing. And then you obviously further test that, and you can, further that down the road as you start collecting more data ingestment of that, of those patient journeys.
Yeah.
Go ahead, Valerie.
Sorry, no, I would just add that, I think we're seeing similar barriers across industries, right? And one of the ways, to Marco's point about like starting small and doing something that's tangible and has, relevant value right out of the gate, is talking about supporting the agents and supporting the experience and not transitioning fully, right? So like when people think about, diagnosing through AI, that's a really scary thing. But when they talk about supporting efficiency of diagnosis through AI, I think that's a very different conversation. And so we talk about that in many of our industries and verticals where, we want to make things easier, more consistent, and more seamless for the agent, that also translates to the customer. And then you start to build that confidence, have some real-time analytics and feedback on that, and grow from there. But to your point, turning something on, starting small and being able to feel and realize some tangible benefits is a great way to kind of overcome that.
Mm-hmm. Yeah, I think there's two big things that we see. One is when you don't have an understanding of the capability, and AI is a great example because it's a mystery to a lot of people, is you tend to be extremely cautious with those kinds of tools, especially in the healthcare space. We had a customer, a large medical device company, that legal had to review every single word coming out of a verbatim that we wanted to use for some FAQs. Some simple FAQs was 6 months in the making. And I think bringing them into the world of AI and customer experience is probably an important step in accelerating that customer's journey. And the second thing I've seen from a barrier perspective is, I say that healthcare providers have a ton of data on patients, and they do. Sometimes it's not organized in a way to take advantage of. So I'll give you an example, right? If you're going to, you belong to a health system and you have 5 different doctors, or situations where you need a doctor on, 5 different specialties column, right? And you call that health professional. It's like, well, which one are you calling about, right? Which experience are you calling about? Are you calling about this specialist over here or this specialist over here? So the profile of data to take advantage of is very diverse. And oftentimes you can't tell what the customer is calling about. So that's where I think tools like Genesys can intervene and ask the customer some simple information. Hey, are you calling about this experience today? Or are you calling about this one? Because then I can provide you a very unique experience related to that, what you're calling it about, versus, when you usually call in, it's this very generic message, right? So the more, I think the more specific we can get with an experience, the better. But it's going to involve, interacting with that patient, if you will, throughout the process to get that specificity.
Agreed. Yeah, Scott, you hit on something really, really important there. And it centers all around data, right? And the data that you're getting from these systems. And so, one thing I'll say, Genesys is, we're just a small piece of the pie, right? Or one piece of the pie, if you will, of the recipe. So, you got a system of engagement, Genesys. We want to help plug in to some of these incredible technology investments that a lot of these health systems have already invested in, right? Think of like Epic, for example, a system of record, right? And bringing these two systems together to get better data and everything unified on one platform to really elevate the patient experience overall. We're part of Epic. We just launched our Epic workshop program, Health CX. But to your point, right, it's starting collecting info from the top, right? So, voice calls, digital channels, the frequency of which, we'll talk a little bit more about why that's important as well here in a second. But you need that vehicle to take action as well, right? So, Valerie, you talked earlier about that patient experience on, when we start talking about, did you follow up on your next appointment? Did you schedule your next appointment? Are you taking the medication? Have you picked up your medication, right? So all these different things that are happening within the patient journey, you need that system of engagement to help really drive that. But Scott, to your point, right? I'm a patient, I'm calling in, first and foremost, security compliance. We need to verify who ID who the patient is. But then again, you go back to that intent for predictive routing, right? Understanding exactly why they're calling in, who they're calling in for, so you can, recommend them to the right care team professional right away, but also understanding preferences, right? Does Marco, does he typically like voice calls? Does he like to be communicated with SMS channels? What does that look like? But then you start, I think start going to the deeper levels, and this is where it starts becoming a revenue generator and a revenue collection, which is a big factor in the healthcare space as well. So again, patient inquiry automation with, natural languaging bots. So things that are simple, scheduling, right? Confirming a schedule, canceling appointment, rescheduling appointment. Candidly, somebody that's 34 years old and a millennial, I don't really need to talk to a human to do any of these things, right? I should be able to do this all fully automated within a platform.
It shouldn't have to be a human negotiation every time, right?
100%.
And that's what it feels like today.
Absolutely. Things as simple as pharmacy inquiries or billing. I just want to see what my balance is. I just want to pay my balance, which just reminded me I got to pay a bill actually for a medical thing here this week. So there you go. But here's where I think it starts going. Now you're starting to address some care gaps, right? And this is kind of a bigger conversation around where we see potentially the future of agentic AI and what that may look like. And, so starting with Omni outbound for patient engagement. So again, care gaps. So reaching out, hey, Valerie, did you schedule that appointment? We just talked about that. Did you pick up your medication? We see that you didn't pick up your medication. Maybe there's an IoT device that's tracking, if you have taken your diabetes testing, right? We see that you haven't turned this device on. Do you need help with that, right? Little things like that. We've seen increasing patient responses from 40 to 70% across our, healthcare, customers. Follow-ups, orders, referrals, right? All of these different things are things that are really, really important in that patient journey that I think a lot of providers and systems think that they're doing today, but they're really not doing today, right? And then let's bring it back to the care teams, because that's really, really important too, is how are we enabling the care teams to deliver these levels of experience with good data on the back end and, really enable them further with good tools like Copilot, where we can real-time hook surfacing information based on what the patient needs and addressing that, or auto summarizations to redirect to reduce that staff effort on documentation after post-call work or things like that. So, but here's another factor, and I'll pause here just to get your thoughts, and then we could talk more about agentic AI. But practicing protocols, procedure information, logistics, all these different things. We talk about compliance and HIPAA and high trust and all these other factors. but leveraging a system of engagement to not only understand the journeys of your customers, but understanding what your care teams are doing in those journeys. Are they doing it right? Are they doing it effectively? And are they doing it to the standards of your compliant procedures within your own health system, right? And I think that's often a forgotten, method in that process as well, to make sure that you are delivering the quality of care that you expect as a health system.
Yeah, it's almost like you need somebody in your organization that's responsible for not just CX, but the holistic experience through legal HIPAA compliance, right? Through all the different journeys of each different division or each different care facility type, to all the things that a contact center might be responsible for, which is getting, answering the phone quickly and treating the customer for whatever need they might have. And I don't think it's all coming together yet.
Mm-hmm.
I'll give you an example. I have a health system here in Colorado. I've had skin cancer, so I want to get a hold of dermatology to set up a skin appointment, a skin check, right? I can't call dermatology directly, so I get into this generic queue that I wait 15 minutes for, and they end up transferring me to dermatology. I said, is there a direct number? It's like, no, we don't have one. So I get transferred to dermatology, and then someone's not there to answer the phone, so I leave a voicemail. And then I don't get a call back. And so I start that cycle all over again if I don't get a call back, right? So I think tying those all together, having somebody that's in the organization or a team of people that are focused not just on service delivery for a specific part of the care model, someone that understands regulatory, someone understands compliance, that can kind of manage that end-to-end view. And I think you have tools on Genesys that can do that. And I think, I see the market, and I've installed these tools for customers, and they take advantage of like 5% of the platform, right? Whereas the platform can manage all of that stuff for you if you let it. And I think that's where these platforms can really, like yours, can really benefit a company, a care facility, a service organization and whatnot. Yeah, talk a little bit more about where AI is heading as it relates to patient experience.
Yeah, that's great. So that's just kind of where things are starting to shift from, Gen AI, right? Which is still, in my opinion, still fairly new to the market overall, and it's still going to be continually evolving. But again, going back to the agentic AI, which you're hearing that a little bit more, and frankly, there's a lot of hype around it. So we need to be careful of what that actually means and who's actually doing what. So but from a healthcare standpoint, right? So think about all the stuff like a doctor, a staff, or a health plan has to do, right? So think about you're sitting at the desk. Here's all the things that we need to do. We need to do face-to-face appointments. We need to schedule appointments, emails, phone calls, enter notes, all of these things that we need to do. And then what are the things that are on that entire desk that are uniquely human? All right, and sift out only things that really a human can do. Think of I think Valerie, you mentioned something earlier, but think of delivering a baby, right? Probably not going to have AI do that, right? That'll be something a human can do, right? And we can think of a number of different examples like that. And so we have to start looking, once you start looking at things from that lens, now we can start thinking about everything that could potentially be AI, right? And it's not going to be everything, but you could start looking at it from that lens. So again, look at payers, providers, there's gaps in care. So typically you might go to a doctor, you get a prescription for visiting that doctor, and you hope they follow the plan as a doctor, right? You don't really know. I don't know if Valerie actually followed through on any of the advice I gave her as a doctor. Did she actually pick up her prescription? Maybe, maybe not. And really, typically, it might not even be, you might even have a next scheduled appointment, or you won't really know until the next appointment a year from now. And hey, Valerie, how you doing? Did you do it? And maybe Valerie's truthful, maybe she's not, right? It's like all these different questions that go on in the doctor office, but you really don't know what actually happened. And so when they don't know, it actually costs providers, insurance providers and payers more money, healthcare systems, and it can potentially further health issues, right? If I'm not taking care of the plan that the doctor ordered, whether it's around diet or around medicine, around all those different things, and they don't really know, I could potentially be coming to you now more frequently, which is going to cost everybody in the system more money and all those different things, right? And so instead, leveraging agentic AI, again, that's not necessarily something that Genesys is doing. We're the system of engagement, but we can power an agentic system that's saying, hey, Marco didn't take his medicine, or Marco hasn't, turned on his device to track his, blood sugar levels, his A1C or any, things like that. and start interconnecting all of these different things so you can really start understanding the patient journey, mobile apps, smart devices, things like that. And really start taking on a role as a human, right? And that's really where I see the difference between Gen AI and Agentic AI is, Gen AI is giving you the tools to collect information, where Agentic AI is giving you the ability to kind of take on the role of a human. Think about what I just said. Everything that in a traditional way is that's a nurse having a call, right? Making a phone call.
Sure.
How many calls do they have to do every single day, every week? That's costing money. That's taking the nurse away from doing, complex, work, things like that. And it's not necessarily tailored to a patient, right? So now you can start tailoring that experience to a patient. And again, as I said earlier, ultimately, this is not really being done now in most cases, right? And Scott, you mentioned something. You mentioned, going to that or trying to get a hold of a dermatologist. It didn't work out. Forbes just did a study that 30 to 40% of patients might choose a different provider even after receiving quality care. And so the likelihood that you're going to go back to that provider to figure out that, for care is likely pretty minimal because of that experience that you just had, right? And so it comes full circle here. Right. If I have somebody that's really proactively reaching out about my care and my needs, and somebody like me that's got a million things that are going on in my life with kids and work and things like that, yeah, I could use a reminder here or two and make sure that I'm doing the quality things about my health. The likelihood of me going back to that provider immediately increased because of just the experience and the ease of quote unquote doing business is for me as a patient. Right. And so it's not about getting rid of humans. I think that's a big kind of a misconception right now with AI. I think there is some of that depending on the level of work a human's doing, if it's very minimal. But overall, it's about how do we get these humans to focus on more complex and, complex type of engagements and conversations. And let's free up some of these resources with AI to fuel these patient experiences overall. And ultimately, it's going to help with revenue collection. It's going to help reduce costs from a management and support standpoint. And ultimately, you're going to retain more patients, which is also a big factor in this, that are going to continually go back to you for care and other things that you might be doing.
Yeah, and reduce phone volume considerably when all the channels are connected together. Go ahead, Valerie.
Yeah. I like that you kind of talked about the evolution too, right? Because, there are certain workflows and things that you can put in place initially while you're developing what that agentic AI experience really looks and feels like. But it's really, we talk about with Infinite Green and with a lot of our customers, that AI is really a lifestyle and it's a competency that you build over time. And I think this is a perfect example of a way that you need to start collecting information. Once you have collected information and you've engaged from a design perspective, that's where you can start to unleash and empower the system and the tools to create more value for your organization, driving more of that ROI bottom line and ultimately patient experience.
Yeah.
And I think absolutely. Connecting, for AI to work foundationally, I think there's a pretty big organizational gap, and healthcare is no different than most big companies. You've got a digital team focused on patient engagement on the web. You've got an operational team focused on scheduling. You've got an IT team focused on, trying to interconnect some of the data points and collect data. And you've got a clinical team that's responsible for tools like Epic, right? And so if you try to put those together, you've got a lot of organizations to weave through to create that end-to-end experience. And I think that's organizationally, we see that as a barrier more often than it is a technology barrier, right? Because, Genesys can do things that a lot of platforms can't do. And the integration to Epic creates a whole bunch of momentum towards being able to design those experiences that we've been talking about. But organizationally, they're not talking, right? They're not on the same page. They might have separate, different goals, right? And so I think as organizations look at AI, they need to look organizationally about how they're operating together so that AI can actually do a comprehensive job at some of the things we've been talking about.
Absolutely. And I'll say this too. It's not and I know you guys know this, right? It's not a set and forget it tool. We talked about contact center a little bit here and customer experience, but we're native workforce engagement all on the same platform as well. So, Scott, to your point, capacity, scheduling, planning. And then we have our entire, customer journey. Let's use patient journey orchestration. That's all integrated natively within Genesys Cloud. So you could start integrating things like your web messaging, your mobile app, and you can really start seeing, hey, where is there friction and fallout? And so it's a tool that, yes, you said it, but it's going to get stronger over time. The more you start to see what's going on in your patient journeys, you're going to get more. You're going to start seeing intent. What are our patients saying about us? We had a customer, Motive Care, for example. They implemented Genesys Cloud from an AI standpoint and workforce engagement. They improved their scoring from 6,000 interactions per month to 24,000 interactions per month, right? Just by implementing AI and some of the capabilities around speech and text analytics and sentiment analysis. So, that's a great example of, hey, you can really scale this thing, but you're also hearing more from your patients. You're getting more data. With that data, you're going to see what's good, what's bad, what's ugly. Let's go fix the bad. Let's go fix the ugly. And let's continue to optimize those environments so that the experiences continue to evolve over time, which also upstreams back to your care teams to be able to deliver those experiences. Not to mention expanding AI capabilities. We talked about doing some self-service around, billing, scheduling, and things like that. So now you're drastically improving your containment rate, increasing your revenue that's coming in, and it's all cyclical with each other.
Yeah, and I think as that evolves, this my direction for companies that we work with is make sure that you're designing those experiences across the organization, not just within your own silo. Not just within a specific specialty, not within a specific function, even though you can create value there. The most frustrating thing about, patient experience, I think, is still not getting to the right place the first time, right? It's still some of the basics, and AI can certainly help with that. Integrations with tools like Epic can help with that. But the teams have to come together and orchestrate something that's across the organization for it to be, to add a lot of value to that end-to-end experience. And that's not tool driven. That's just people being able to organize themselves and get in a room and say, this is what's best for the patient. We're gonna manage it across our teams, across the org, et cetera.
Mm-hmm.
Yeah, and that's not easy for any organization, certainly not healthcare. But it has been really fun over the last 10 years or so to see really the trend of focus on transitioning from, viewing patients to really trying to, I think, Scott, to your earlier point, really mimic that general consumer experience in the healthcare journey. And there's been, a lot of efforts from a voice of customer perspective to really infuse that and create more of that experiential element, create some loyalty that's all, driving that bottom line. But certainly has been a shift from, old legacy organizational views, I would say.
Yeah, exactly. Well, Marco, appreciate the time today. That was a good conversation. I know 30 minutes goes by fast.
It does. Yeah.
Just a couple of things. If you're interested in anything we talked about, reach out to Marco at Genesys. He loves to talk about this stuff. You can schedule a meeting with Infinite Green using our QR code in the upper left. If you're in the Vegas market and want to connect with us, we'll be out there the week of the 24th of March, 2025, if you're watching this years from now. We also have Genesys is sponsoring an event with Infinite Green out in the Denver market on April 23rd at Topgolf in the afternoon. And again, you can find that on the Infinite Green page on LinkedIn. We'd love to see you. It's going to be a conversation about modern CX design and modern capabilities as well. So a couple of ways to meet us in person if you're in those markets at those times. But Marco, thank you again for conversation. Valerie, thank you.
Yeah, thank you for having me. Really appreciate it.
We'll talk to everybody soon.
Thanks, everyone. Have a good day.
Thanks all.